Uh, C1 fracture, which is basically a spondylolisthesis at level of C2 to C3, is called a Hangman fracture. It usually happens in polytrauma cases or road traffic accidents. These injuries are mostly highly unstable and can be identified by a subtle flexion teardrop injury at the level of C2, C3. This happens due to extension injury, which happens in road traffic accident and hanging. It is classified by the Levine and Edward classification. If there is less than 3 mm of horizontal displacement, these can be managed as rigid cervical collar and they are rendered stable. If there is a 3 to 5 cm of displacement, should be reduced and a halo should be applied. If there is more than 5 mm or facet dislocation or 11 degree of angulation, this needs posterior C1 to C3 fusion or bilateral C2 pars screw osteosynthesis.